why health messages often feel shorter as we get older. Over time, something subtle tends to happen. Health messages do not necessarily disappear. Instead, they seem to shrink. What once felt like a conversation now often feels like a sentence. What once included explanation now arrives as a brief reminder. For many older adults, this change is noticeable, even if it is difficult to describe. The words are familiar, the themes are familiar, and yet something feels missing. When we are younger, health information often comes with context. There are explanations, examples, and conversations that stretch over time. Questions are expected. Curiosity is encouraged. But as the years pass, health messages are more likely to arrive already condensed. This is not because older adults need less information. It is because the way information is delivered has changed. Modern health communication places great value on brevity. Messages are shaped to fit headlines, short segments, and quick exchanges. In this environment, shorter messages are easier to repeat and easier to distribute. Over time, these shortened versions become the standard. For someone who has lived through decades of health messaging, this can feel like a loss. Not because the ideas are unfamiliar, but because the explanations that once surrounded them are no longer present. Another reason health messages feel shorter is memory. As messages are repeated across years, the longer discussions fade while the simplest phrases remain. What is remembered is not the reasoning, but the conclusion. This can make it seem as though health advice has been reduced, even when it originally came from thoughtful discussion. The message itself has not changed, but its framing has. There is also the role of assumption. Health communication often assumes that older adults have already heard the explanation. As a result, messages are delivered as reminders rather than conversations. The tone shifts quietly from exploration to repetition. For many people, this shift can feel distancing. It suggests familiarity without acknowledging change. Life continues to evolve, yet the messages addressing it appear frozen in time. Another factor is the audience itself. Health messages aimed at broad populations must speak in general terms. As people age, their experiences become more individual, not less. Short messages struggle to reflect this growing complexity. This mismatch can make health information feel incomplete. The message is present, but the listener does not feel fully addressed. It is also worth noticing how silence plays a role. What is not said can be as important as what is said. Short messages leave little room for nuance, uncertainty, or personal context. They prioritize clarity over depth. This does not mean health communicators are careless. Often, they are responding to limited space, limited time, and limited attention. But the result is a style of communication that may feel increasingly narrow with age. For older adults, this narrowing can create a quiet sense of disconnection. Not confusion, but distance. The message arrives, but it does not linger. It does not invite reflection in the same way it once did. Understanding this can change how these messages are received. Feeling that health advice has become shorter is not a sign of declining attention or patience. It reflects a real shift in how information is shaped and shared. Health understanding does not always grow through more messages. Sometimes it grows through recognizing what has been compressed or left out. As health messages continue to circulate, it may help to see them not as full explanations, but as fragments of longer conversations that once existed. And in that recognition, there can be space for calm understanding, rather than frustration or fatigue. This content is for general educational purposes only and does not provide medical advice, diagnosis, or treatment. Health topics discussed are informational in nature. For personal health concerns, please consult a qualified healthcare professional.